Because mosquitoes are generally daytime breeders.
Okay.
They not only breed in the dirty water, the thing is they breed in stagnant clear water.
Have you seen any such areas in Hyderabad which are more prone to dengue cases?
So there are a lot of places in and around Tolichoki area, in and around Old City area, in and around even developed areas like High Tech City. There are a lot of lakes and there are water bodies. So that is the hub where all these mosquitoes breed.
People think that if their CBC test report is normal, that means they're safe.
The symptoms stop. The platelets start decreasing after that. So it is always advised to repeat the complete blood count every alternate day.
Namaste and welcome to the Apollo Health Podcast, Health Conversations That Matters. Today's topic is something almost every home worries about during monsoon: fever. One person in the family gets a high fever, body pain starts, and then weakness follows. And suddenly, everyone has the same question: is this just viral fever or could it be dengue? And honestly, that confusion is very real. Because in the beginning, dengue can look like a regular viral fever. But the difference is, if you miss the timing, things can become serious very, very quickly. So today, we are decoding how dengue is different from a normal viral fever, when to get tested, and when fever should never be ignored. Today's conversation brings together Apollo Clinics and Apollo Diagnostics, where clinical expertise meets diagnostic clarity to help families understand dengue better, act earlier, and seek the right care at the right time. First, we have Dr. Mir Salman Ali, Head of Microbiology and Infectious Diseases at Apollo Diagnostics, and Dr. E. Nikhil, MD Internal Medicine from Apollo Clinics. Hello, doctors. Thank you for joining us.
Namaste and thank you for having us.
Thank you for having me.
Doctor, so there's one common question everyone gets, especially during monsoons. When they get fever, like how exactly they're going to know if it's just a viral fever or is it dengue?
Yeah, that's a fair question actually, because most of the acute infections and viral fevers and bacterial fevers initially present same with fever with chills, headaches, body pain, vomitings and all. But coming particularly to the dengue, there are some signs like the fever here will be very high grade fever, and the weakness and the fatigue and the dehydration will be very profound in this. And characteristically, there is something called retroorbital pain. The patients will come in and telling that there is pain behind eyes. So that is more seen in this dengue, and there will be rash. And one more thing, the pain is so intense that the patients complain it is as intense muscle and an intense joint pain. That is why dengue is also called as breakbone fever.
Oh, okay.
So that is how we difference between the intensity and symptoms between other viral fevers, bacterial and the dengue fever.
And doctor, talking about the diagnostic point of view, how can someone get early diagnosis for the dengue, and what exactly are the early symptoms?
To understand the diagnostic perspective, so it is very important because the most common thing that we see is patients do not get tested earlier on when the symptoms arise. They try to prolong it. They think it is a viral fever. They try to prolong it, take over-the-counter medications, try to delay testing. So what happens in this is testing of dengue is very important in the initial phase, in the initial 1 or 2 days. But what happens is the patient prolongs it for 7 to 8 days, gets tested after that, which will give a result which is not correlating with the clinical symptoms. So it is always advised to go for the testing initially in the onset of symptoms. In the first or second day, the dengue NS1 test can be done, and then simultaneously, along with that, a complete blood count and a CRP test can be done. Testing has to be done in the initial 1 or 2 days. A dengue NS1 test is advised in the initial phase of the symptoms.
And Dr. Salman, in the diagnosis point of view, when should someone be diagnosed by dengue, and how exactly are the early symptoms of it?
So when it comes to diagnosis, early testing is very important. Usually what we see is people try to delay their testing by 7th day or 8th day, which is not recommended because when we are testing for dengue NS1 is very critical, which appears in the initial stages and it disappears after 5th or 6th day. So dengue NS1 is very important in the initial phase of testing. Then we come to antibodies, that is the IgG and IgM. Along with dengue, it is also important to go for complete blood count as well as CRP.
So Dr. Nikhil, sometimes what happens is, let's say someone has fever in a family, and then initially, like after 2-3 days, it gets better. But later on, again, it worsens up and they start getting vomitings or other factors develop. So how should they take it, or is it a sign of dengue?
So my simple rule is, first of all, the fever. High fever is persisting for more than 48 to 72 hours, that is 2 to 3 days. First, you have to seek immediately doctor. And coming to the dengue pattern, so dengue has mainly 3 phases. So first phase being febrile phase. So that will last up to some 4 to 5 days, where in this the patient will be having high fever, weakness and all. The second phase is the critical phase. This phase is the important phase, where the patient, the fever will coming down and actual signs of dengue like bleeding manifestations, abdominal pain, worsening of vomiting and the platelet count drops. If patient passes this phase, then the third phase is a recovery phase.
Okay.
Recovery phase is when the patient recovers, the platelet count goes out, becomes normal and all. So immediately once the patient is where the fever is not reducing for more than 2 days, worsening of the vomiting, any abdominal pain, any rash, red color rash on the skin, if these signs are appearing and very dehydrated patient is, weakness is worsening, you should immediately go seek help.
Also, Dr. Nikhil, what exactly are the red flags that someone seriously need to consider and go to hospital?
So coming to the red flags in dengue fever, you will start seeing some nosebleeds, bleeding from the gum,
Okay.
abdominal pain, breathing changes, there will be difficulty in breathing. Then there is something called black color stools, which also called as melena, that occurs due to a decrease in platelets. Again, the worsening of the vomiting, severe weakness. These are some red flag signs. And more severe, we'll see patient being confused, being cold and clammy, disoriented. So these are some important red flag signs which we should keep in mind for dengue fever.
Adding on to what Dr. Nikhil mentioned from a diagnostic perspective, it is very crucial that the testing be done immediately when the symptoms start. Do not wait till the last moment and do not wait for the symptoms to increase, then go for testing, because that will again cause a confusion in the diagnosis.
And doctors, here we have a few questions which can be myth busting as such. A lot of people will have common beliefs. So I want to clear it out, right? So the first question is for you, Dr. Nikhil. So when we talk about papaya leaf juice that cures dengue, so is it true or false?
So this papaya leaf extract, so there is some research and some articles where they mention it increases the platelets or it stops the destroying of the platelets, but that's supportive measure. That's not a complete cure. So once if patient starts drinking papaya leaf extract juice in the home and is ignoring his platelet drop count and other symptoms, then that is a dangerous call by him. So that papaya juice extract leaf juice, that is never a replacement for that.
Okay.
So that's just myth.
Okay. So I have another question for you. Ibuprofen or aspirin for fever. This is something that a lot of families use, right? So is it correct to take them, or is it just an additional usage?
So this point I wanted to make it so clear and so important that ibuprofen and platelet, these are painkillers and easily available over the counter medications. These are actually blood thinners. So in dengue, as I already told, the platelets are fragile, there is decreasing count. So these will make platelets more fragile and cause bleeding tendencies and internal bleeding. So never ever take these drugs in any body pains or any fever without any medical help. So no.
Okay. So Dr. Salman, this question is for you. People think that if their CBC test report is normal, that means they're safe. Is it correct?
Yeah. So what generally happens is the platelet count, which is reported in a complete blood picture, that is a CBC report, it starts decreasing after the symptoms subside. Okay. So what usually happens is when a patient comes and he has certain symptoms, he takes medications for the symptoms, he starts recovering from the symptoms, and his complete blood count is showing a normal platelet count. Maybe it is showing 150,000. But then once the symptoms stop, the platelets start decreasing after that. So it is always advised to repeat the complete blood count every alternate day in the initial phases. When there is a decrease and there is a decreasing trend of platelet count, it is advised to do it every day, depending on what the platelet count is.
Also, Dr. Salman, they say that only platelet count matters in dengue. Is it true?
So to some extent, yes, but that is not the only criteria. Along with platelet in complete blood count, we also monitor WBCs, and once a diagnosis comes, yes, platelet is very important. So the initial till about 1 lakh, the platelet monitoring has to be done, as I mentioned, alternate days. Then after that, it is advised to get it done every day till about 20,000. After that, it becomes a very critical, and hospitalization is very important.
Okay. And can viral fever and dengue initially look similar?
Yes.
Okay. And can platelets reduce infections other than dengue?
Yes.
And should antibiotics be started immediately during fever?
Not with the proper medical advice.
Okay. And can dehydration worsen dengue complications?
Absolutely.
And this one is for you, Dr. Salman. Can tests help doctors identify infections earlier?
Yes, it does help.
Okay. Yeah, and that's the end of the rapid fire. Thank you so much. And doctor, once when someone is diagnosed with dengue, what exactly can be the recovery process?
So for uncomplicated dengue fever, the recovery would be somewhere around 7 to 10 days. So we can wait there just with the hydration and monitoring we can do. But even in dengue, this is something called as post-viral fatigue. So
Okay.
this will be there for some 2 to 3 weeks, where the patients will be experiencing little bit mild body pains and generalized weakness. So patients should be careful, and they should be hydrated well with ORS, coconut milk, with fruits and with good hygienic food. And they
Okay.
should make sure that they shouldn't rush to the work immediately and lack proper sleep and all. So this is how the recovery is.
Also, Dr. Nikhil, when we talk about the preventive measures for the dengue, how exactly someone can have the prevention measures taken care of?
So this dengue is generally occurs by a mosquito bite. So the mosquito is Aedes aegypti mosquito.
Okay.
So these mosquitoes are generally daytime breeders.
Okay.
They not only breed in the dirty water, the thing is they breed in stagnant clear water.
Oh, okay.
So that's why the most common time when they bite and we get infected is during early morning, and most probably during afternoon and early sunrise times.
Oh,
So we must they breed near the water coolers, near the flower pots and storages near our home water, wherever there they breed there. So we have to stop storing the waters there. We have to clear our cooler waters for every 3 days to 1 week, and we should use mosquito repellents, and we should be aware that we should stay away from this during the season and outbreaks.
Dr. Salman, have you seen any such areas in Hyderabad which are more prone to dengue cases?
Yeah, so as Dr. Nikhil rightly said, it is all those areas where there is stagnant water.
Okay.
So wherever and nowadays in Hyderabad also, they have a lot of new lakes coming up, and we have a lot of water bodies. So we have to ensure. So there are a lot of places in and around Toli Choge area, in and around Old City area, in and around even developed areas like High-Tech City. There are a lot of lakes and there are water bodies. So that is the hub where all these mosquitoes breed.
And that's all about it. And thank you for joining us, Dr. Nikhil and Dr. Salman. I've really got deeper insights into the dengue. A lot of times we tend to ignore a fever, just saying it's viral fever because of the monsoons and all. I think this one gives you a proper insight about how exactly someone has to take care of dengue and how exactly it can be treated and everything. So thank you for joining us today. I hope you all loved the podcast. I'm sure you got deeper insights about how exactly this differentiation between the fever and dengue, and when should you actually take a fever seriously, and the prevention measures, symptoms, the diagnosis, and a lot about dengue as such. This is the time where you should actually be very careful and should actually keep noticing about the smaller details about dengue. So to know more such health facts and to know more about such health topics, follow the Apollo channel and subscribe to us. Thank you so much.